Good morning, good afternoon, and good evening, depending on where you're calling in from today. Kia ora koutou, no mai, haere mai, as we would say here in New Zealand, and te reo Māori, which means hello and welcome to you all. My name is Vivian Hunt, and I work for the Centre for Social Data Analytics, the CSDA, which is a research centre hosted by the School of Social Sciences and Public Policy at Auckland University of Technology, or AUT University. CSDA also has a second site at the Institute for Social Science Research at the University of Queensland. And I'm delighted to welcome you all here today to listen to a webinar on how predictive risk models are being applied to support child welfare decision-making. The CSDA has been developing tools that use predictive risk modeling to identify children at risk, and we've been mainly working in the US with the Departments of Human Services. The first of our screening tools that we developed was with the Allegheny Family Screening Tool, which was deployed in 2016. This has been the subject of an independent evaluation, which we can share with you later. Over the last few years, building on that experience at Allegheny, the Centre has developed a number of tools for other US counties, and we have work in the pipeline for state-level applications. Now, our speakers today will probably not need much introduction. So we have Professor Rhema Vaithianathan, who is the Professor of Economics at AUT University. Rhema has specialized in health economics and data analytics for over 20 years, and I've worked with her a long time. She is the founding director of the Centre for Social Data Analytics. She's also the Professor of Social Data Analytics at the Institute for Social Science Research at the University of Queensland. And it is through her extensive international network that Rhema first started working with Professor Emily Putnam-Hornstein in 2014. Emily is the co-director of the Children's Data Network and the John A. Tate Distinguished Professor at the School of Social Work at the University of North Carolina at Chapel Hill. She is a research specialist with the California Child Welfare Indicators Project at UC Berkeley, and her research focuses on epidemiological methods to improve the surveillance of non-fatal and fatal child abuse and neglect. I should just add that both Rhema and Emily are passionate about using data analytics that can inform child welfare decision-making. So before I hand over, can I just hand over to her? So Emily's going to start by giving us a sort of big picture perspective and talk about some of the other tools that are used. But before I do that, could I ask you just to all make sure you're on mute, and if you have any questions, please send them via chat, and we'll either stop the presentation, I'll read out the questions, or we'll have them at the end of each presentation. Rhema will follow up with some applications of the work that's been done with Allegheny and others. So I'll hand over to Emily now.
Terrific. Thanks, everybody. Appreciate the opportunity to chat, and just want to reinforce what Vivian said, which is I think it's a small enough group that please throw things in the chat as we go, because it's ever so much more interesting if we're able to engage with you. As Vivian said, I'm going to just kind of walk through a little bit of the basis for this work, casting kind of a broad brush understanding of the landscape of kind of the front end of the child protection system. And that's really where I believe that some of the applications we're developing have the greatest opportunity to have a significant impact on children and families. And so before I walk you through a few other slides, I want everybody, I know we're all coming from different jurisdictions, maybe different countries. And so I just want you to kind of think about, first of all, what tools does your county or state or jurisdiction use today to screen child abuse and neglect referrals? What information does your agency provide to supervisors to promote effective supervision, as well as support decisions around post-investigation services? For those of you who are in the US, what kinds of risk assessment tools is your county or state planning to use when moving forward with FFP or Family First candidacy determinations? And for everyone, what data is your jurisdiction using to review decision-making through a racial equity lens? So just kind of hold on to those questions and thoughts as I go, because I think that one of the things that's been really interesting as we've moved through this work is we've come to appreciate how little attention we have been paying to the tools that are currently used in our system. And so everyone's getting very kind of concerned, oh my gosh, what are the implications of predictive risk modeling, without actually reflecting on, well, how are we screening and making decisions today? So here's my argument for why we need new approaches and why our current tools are inadequate and have not kept pace. We in the United States, a third of American children are investigated for abuse or neglect every single, I'm sorry, not every single year, that would be terrible. 7 million children are reported for abuse or neglect every single year, and a third of American children are reported for abuse or neglect during childhood. And that is just kind of a jaw-dropping, staggering set of statistics, and one that I think a lot of lay audiences and the community are not necessarily aware of. I think historically we've thought of our child protection or child welfare system as being a safety net that touched a very small number of abused and neglected children. And what has happened over time is that when there have been tragedies, we have tended to expand definitions of abuse and neglect, expand the universe of individuals who are mandatory reporters, and that has led to a system that surveils and investigates large numbers of children without providing services to all that many. To reinforce that, this was actually an article that was just published last week, where we conducted a study in California and found that the child protection system investigated almost half of Black and African American children in our state between birth and age 18. And I bring that up because I think we need to appreciate that the burden of a system that is not equipped with the proper screening and triaging tools disproportionately burdens families of color and low-income families. So the numbers are huge. We have a system that's touching millions of families each year. Okay, so what is predictive risk modeling and how might that potentially help? So when we talk about predictive risk modeling, and I'm sure many of you know this already, but I just want to level set with kind of a baseline definition as we move through this conversation today. Predictive risk modeling really just means that we have implemented some kind of automated tool or model or algorithmic process by which we are generating a score or a predicted probability that some future outcome or adversity occurs. And the benefit to using predictive risk modeling is that it can allow us to then do a better job risk stratifying large populations or large groups, which can then help us to determine where we can best direct resources to hopefully prevent the adverse event that the model has been trained to predict. And the beauty of predictive risk models includes that with kind of technological advances, with vast volumes of data and information that are now available to our child welfare agencies and our human service agencies, these models can incorporate that much more information into making an accurate prediction that can allow then for better classification of risk and hopefully the deployment of preventative services. In the context of child protection, where are these types of tools being explored for use, and can they work alongside other tools? So here, what I've done is I've just kind of outlined the three places where we've tended to see the greatest opportunity and hear the greatest interest on the part of jurisdictions that we've either worked with or are talking with. And so to just walk you through how these models could fit within this front-end decision-making trajectory, moving from left to right, we have calls that come into the Child Protection Hotline. Those are screened by individuals who will be reviewing a family's history manually, hearing and fielding information from the reporter about the current allegation that has led to this call. And often these workers will be asked to complete some kind of structured hotline tool, which will often just serve as a way of ensuring that we're systematically gathering relevant information, and it will also often be cross-referenced with legislative kind of rules around what constitutes abuse and neglect. This is a place where, rather than having workers manually go through administrative data to try to gather information about the family, a risk algorithm can do that much more quickly, much more systematically, much more equitably, and can generate a score on the fly that can be used as part of the decision-making process when we determine whether we will screen in that call for investigation or not. As we move forward to the second place where I have PRM2 labeled, the other place where we've seen predictive risk models being explored includes during that period of investigation, where what tends to happen is we are operating with partial information that's been communicated through the call, and then the caseworker or the investigative worker will be gathering information throughout the investigation. But often, a lot of the tools that we're currently using, risk and safety tools, are gathered and completed towards the end of an investigation. And so the opportunity we have with a predictive risk model is to think about upfront what investigations are more likely to have high levels of risk or history, where we might want to bring different community partners to the table early, deploy resources differently, have more supervision consultations, or potentially staff a particularly complex investigation differently. And finally, moving to the third section where I have PRM3, we can also think about using risk algorithms post-investigation to support determinations around kind of case opening and supports and services. And I want to really reinforce that there's no application here where we're talking about the risk algorithm in any way replacing the human decision maker. The algorithms are really being set up to make better use of data so that humans can be better decision makers in the services that they provide to families. Okay, so what distinguishes those predictive risk models that can be implemented alongside existing tools or can potentially replace some of those existing tools? So here, what I've done is I've just mocked up just a bit of a comparison. And this is where, for those of you who are remembering the first set of questions I asked you to think about, I want you to think about what kinds of hotline or risk tools your jurisdiction currently uses. With those in mind, when we think about a predictive risk model, what we're talking about is a model that can use information in an existing administrative data system, so no new data collection needed, versus traditional risk assessments where workers are asked to gather and fill those out, which ties directly to use of data, because if we're going to ask a worker to manually gather and enter information into any kind of operator-driven tool, there will be a limit to how much information and how much time we can ask them to take. So most of the risk tools that we see have anywhere from 15 to 30 data elements that are completed. In contrast, a predictive risk model can extract and use hundreds of data points to estimate risk. Traditional risk assessment tools, again, because they have that human component, are typically completed only at the conclusion of an investigation, whereas predictive risk models can be generated at the outset upfront and then can be rerun at any point from screening to case closure. And then kind of this next four, I'm not going to go through cell by cell, but the short version is that we have done comparisons between these algorithms and traditional risk assessment tools. And what we find is, not surprisingly, when you have an algorithm that doesn't have the measurement error or manipulation problems of people filling them out, and when you have a model that can use information from hundreds of fields as opposed to 24, we find that they tend to produce much more accurate classifications of risk. And so just to give you an example of one such tool, far too small for you to see the specifics, this looks very similar to dozens of others that are implemented in various states. But what I want you to focus on are just the boxes to the right, where I have flagged of the questions that are included on this risk tool. All of the blue are things that could be obtained directly from the administrative child welfare data, but right now workers must look up and fill out. The orange are what I would very strongly describe as subjective assessments. And that doesn't mean that someone's intentionally biased in how they fill it out. It just means that there's going to be significant measurement error across individuals who complete this tool. The green I have described as information that's repeated, and then the blue is it's repeated and confusing. So these are the tools that are typically used in dozens and dozens of states. And now I'm going to turn it over to Rhema so she can talk a little bit about what the Allegheny Family Screening Tool looks like and some of the ways that predictive risk modeling are being used.
Thanks, Emily. I will now share my screen and
do post any questions you might have in the chat so we can discuss those as well as you're talking. Thank you.
Sorry. You display. Thank you, Emily. As Emily said, one of the areas that we're very interested in is the front end of child protection, because in lots of countries we've looked at, we see that we are touching a lot more children than we would have thought when we first set up the child protection system. So I'm going to speak briefly about the more kind of nuts and bolts of a PRM project and what it is and what it does. So I think Emily probably covered this, but it's worth repeating. The way a PRM, say a hotline decision aid tool works is as follows. A referral comes into hotline or online if your jurisdiction has an online portal where mandated reporters can file a report of concern of abuse and neglect. Once that goes into the system usually works to try to identify which children, whether the children, the alleged perpetrator, the parents are known to the system. And 90% of referrals are really re-referrals. That is, mom or dad or alleged perpetrator are known in the child welfare system. So the data from those previous history is all instantaneously gathered and structured into multiple elements, hundreds of elements of history, patterns of allegations. So an element of history might be the alleged perpetrator had 5 previous allegations, may not even be with this family, but with previous households of sexual abuse. That will become a risk element for the predictive risk model. But because it's all computerized, it happens instantaneously. Once those features are brought to the predictive risk model, they're weighted and it produces a score. And the score is simply a stratification device. It allows people to see a stratified set of referrals. So take all your referrals today, you can see that there's a bunch who are 10 out of 10, but a bunch who are 1 out of 10. And so it's an instantaneous stratification tool. You could have a prediction score from 1 to 10, it could be 1 to 20. Now, what does this risk mean? Well, in most of the jurisdictions and with research we've done in other systems, we have found one of quite a good prediction is a prediction of removal in 2 years. So that's essentially what the predictive risk models that we've deployed do. Say 10 means this child is at very high risk that within the next 2 years, they will be removed from home for for maltreatment concerns. So a PRM, and this is me showing you how well it predicts in Colorado. So it's simply a stratification tool. In Colorado, the model we've deployed scores every child from 1 to 20 at referral. We've gone and scored a number of historical cases, just a random selection of historical cases of referrals. And because they were historical, we could follow them in the data. And we showed that children who the predictive risk model scored as a 20, half of them were removed from home in the next 2 years. So to be clear, this is not a perfect tool, because if it was perfect, then 100% of children who scored a 20 should have been removed. On the low risk side, there are still 0.5% of children who scored 1 were removed. So scoring 1 doesn't mean you will never be removed. But it does suggest that this stratification tool does a reasonable job of separating high risk and low risk children. The reason we call it a stratification tool particularly is that, unlike other types of tools, the way this tool works is by design, 5% of your children are going to be scored a 20. 5% are going to be scored a 19, and 5% are going to be scored a 1. So it stratifies and bins your population of referrals into these 5%, or if you have a score from 1 to 10, into 10%, into 10% groups. Now, having received and daily stratifying the referrals that come in, obviously, one thing we can use it for is to actually, as a live tool, to support your call screeners making decisions. The second use of it is as a score for a QA tool. So with One County Partner, for example, we've gone and looked at all the children who were removed in the last 6 months in that county. And what we've done is we've gone back and looked at what scores they received all the way back to when they first were seen in the system years ago. And what you find is that those scores are accelerating as they get closer to this first removal day. And what the county is doing is looking back at historical practices with respect to these children who in the end got removed, and we all know we did not want that, and trying to understand whether with the score plus a change in practice, they could have better prevented the removal for a few of these children. Now, we have to be clear, there is no magic bullet. We will not prevent 100% of these removals. We cannot, we will not. But we still need to understand where we're missing preventive opportunities, because those preventive opportunities are the reason child welfare systems exist. So we have to do everything in our power to understand and lean into those opportunities. The third use of this is to understand the race equity practice of our system. These stratified tools is like a mirror of our system. And when we've held this mirror up to multiple jurisdictions, what we've found is that Black children who score a 20 are more likely to be screened in than arguably an identical white child who scores a 20. Why do I say identical? Because when we go and look at the removal rates, both Black and white children have similar removal rates. When we've gone and looked at hospitalization for maltreatment, as we have done in studies, the Black and white child has similar maltreatment hospitalization rates. So these two children, when they score a 20, are indeed at risk. And yet we consistently underscreen in white children. On the other end, we find that Black children who receive low risk scores, who we can show definitively are at very low risk, nonetheless are experiencing substantially higher screening rates. Now, this is not something the tool itself can solve. It is something about the way call screeners and our systems see risk. And understanding that and responding to it is part of that long journey to trying to reduce institutional bias in our systems. And I'll talk a little bit more about that in a minute. So where our systems are being used are in Allegheny at Hotline application, at red team screening, and in supervision. So these are all different points that Emily's already talked about. And here's a screenshot of 2 examples of our tools as they are being used. The top is Allegheny, where it's done on the fly. So a call comes in, the call screener enters the details, clicks the calculate the screen score button, and the call screener can immediately see a thermometer and the score. The bottom one is used the day after the call comes in, because in Colorado, the way the tools work, way call screening works is it's a team approach. It's called a red team call screening. And so when they meet as a team, they enter the referral into the portal and immediately receive a score, and they're reminded of what that score means in terms of removal risk. So when we engage with counties and states in these sorts of projects, the first 6 months, first 6 to 12 months is really answering 3 questions. Is the data systems in that county and state reliable enough to predict removals or other long-term outcomes? When we go back and score some of these counties' cases and understand what the practice was and look at what the practice might have been if the score had been available, do we all, the county, the state, see an opportunity for better practice? Because we're driven by improving practice. So we want to carefully understand what changes in practice might have made a difference to families that the counties were serving. And the third question we always ask in this first stage is there concerns about the accuracy of this tool for different racial subgroups? Stage 2 of a PRM, once the agency is satisfied that those questions have been adequately addressed, we move on to a more practical deployment stage where the staff are trained and the tool is used. We provide ongoing technical and management support of the type I was describing, where we look at whether the tool is working in the way that is expected from a technical point of view. And we also encourage our county partners to undertake independent evaluation to understand if there are unintended adverse effects and whether the benefits that they have communicated are being achieved, and providing practice feedback. Now, bias is a question we are often asked about predictive risk models. And I suppose the answer that I increasingly give is yes, data is biased, but we've got mounting evidence that humans are biased as well. And so why would I expect data to improve? Well, I think humans with well-structured, carefully designed data tools could be less biased than humans on their own. Why? I think this is particularly the case in child welfare, because the research shows that bias thrives under 3 conditions: when information is ambiguous, when people are under time and emotional pressure, and there is a single perspective. We know that this is almost definitionally the conditions under which decisions like call screening are made. We've studied some call screening teams, and we calculated that these decisions are made within 10 minutes. By providing PRM data tools, we can reduce the ambiguity of the information, and we can add a sort of another perspective, the perspective of data. The value of data is its consistency. The The disadvantage of data tools is that it cannot contextualize. So that is why the call screener, the caseworker, the social worker can contextualize the information whilst considering the data, what the data is telling them. So the questions we ask when we, in that stage one, when we try to understand bias, and I'll tell you how we answered it in our first project with the Allegheny Family Screening Tool. Is the tool equally accurate for different racial groups? And indeed, in Allegheny, the AUC, which is a general measure of accuracy, was the same for both racial groups. Is the tool also predictive of outside measures of abuse and neglect? And what we found is that high-risk Black and white children had similar rates of maltreatment hospitalization within following receiving a high-risk score. So when we looked at sort of more ground truth universal measures of outcomes like maltreatment hospitalizations, they were similar. And once deployed, does the tool reduce racial bias? An interim evaluation by Stanford suggests that there has been a reduction in the racial disparities, in particular an increased awareness of risk amongst the white children. And there's ongoing evaluation by a PhD student at UCSD who is finding similar results. So when we work in this space, we're very conscious at the center and our research collaborators of the need for there to be guardrails. And the guardrails the CSDA favors are the following. First of all, we really need the agency to lead the project. So all our projects are led by agency leadership. We advise them, but they decide how they'll be used, what restrictions there will be on who will see the score, what the benefits of that tool are. We think transparency and fairness is super important. Transparency so that communities and particularly families who will be part of the system where these tools are used understand and are able to express their concerns. And community voice is also part of that. And as I already mentioned, an independent evaluation, an ethical review, and a multidisciplinary team. So I will leave it there and have some time for questions.
Thank you. Thank you. Thank you. Oh, I'm trying to start my video. Thank you very much, Rhema and Emily. That was fantastic. And I do have a question just while people think of some questions. So Emily spoke about the traditional tools and the disadvantages of those. So, and you pointed out a few, and I think the one was around ambiguity and sort of inconsistency in data. So a question I have is really, it's maybe to both of you, do you think that these tools, the PRM, so that's the biggest sort of role that a PRM tool can play is actually helping to reduce that ambiguity?
Yes, I mean, I can take a first pass at it. I think it does increase the confidence that that caseworkers have about decisions, because we do know that when you don't have, we are not providing a lot of really high quality, consistent tools for caseworkers to use. And so I think these sorts of tools do help to improve the sense of confidence in work that caseworkers have to do.
What do you think, Emily?
Yeah, the only thing I would add to that is, again, the amount of information that we now have in our administrative data systems, it's just tremendous. And with new CWIS systems, it's going to be even larger. But how we equip workers to review and weight all of that information, we just haven't given them the tools. So it's very inconsistent. And that's where, again, not that predictive risk modeling solves all of our problems, but it at least provides a more standardized way of assessing the totality of the information that we have, so that that's used consistently.
Yeah. Yeah, I thought that the time pressure too must be an aspect that's helpful when you've got that time and emotion and making decisions. And that's where a systematic tool like the PRM could help.
And on that issue, I also do find that jurisdictions feel that before they apply a PRM tool, they need to have perfect data. And to be honest, we have yet to find a jurisdiction where these tools cannot predict system involvement. So it isn't actually the methods and techniques that we use allow imperfect data to be discarded and rely on data which is meaningful. So there is a methodology behind it, which means that even if you think that your data is not up to it, it is worth exploring, because to be honest, we haven't actually found a system where we haven't had that problem. And I always joke with my colleagues at agencies, I've never worked in an agency that isn't reforming its case management system, and I've never worked in an agency that has done it. So everyone's doing it, no one's finished it. So if you're going to wait till you finish it, I think that's not, you're not going to get the full benefit of data that you probably have and are not stretching to its value.
Yeah. The other question I have, you mentioned ethics, Rhema, and I know this, but every project you go through is part of a university as an ethics application. Could you just talk us through that a bit?
Yes, so because we're an academic, so we are an unusual centre in that we sort of provide services to our agency partners, very much like in this deployment space, we deploy tools for them. But unlike kind of more commercial providers, we also have a requirement within the university to obtain ethics approval from our university ethics board for everything we do. That's not the only bit of ethics that we apply to our work. We also work with professors of ethics to discuss what we're doing, understand whether there are ethical constraints that ought to be applied. So, but that's one of the components of the multi-strategy approach we take to ethics around this work.
Yeah. I'm still waiting for some questions. I've got some feedback that, but no questions, unfortunately. So Emily, just question from you, for you. With these, you obviously have been quite involved in the non-traditional methods, and you talked about this long journey that people need to go through in terms of practice. And it's, I've heard you refer that it's not an easy thing to change practice. And, perhaps you could comment a bit more on that, about the whole practice of making decisions and the tools that are available.
Yeah, well, I mean, that's where I do think that, Rhema alluded to the amount of time that it takes up front to kind of understand what each individual agency's practices look like. Because I do think as much as we are trying to not just build a great model on paper, but to actually implement that model in a place where it is used and it affects practice and it improves outcomes for children and families, I think we've come to greatly appreciate how complex these systems are, and that it really is about situating them in a place where it works for the workers and the supervisors and isn't creating additional work, but is actually a part of their business flow. And that really, I mean, Rhema, I don't think you disagree. We have yet to encounter a jurisdiction that doesn't have more than enough data to work with, but to be honest, how you identify the problem that is most salient for them that can be not solved, but improved through the use of these algorithms, I do think has varied across jurisdictions.
Definitely.
Yeah. Okay. Well, thank you. I think we've people are too shy to ask questions, so I think I'll wrap this up now. I do thank you very much, Emily and Rhema, for presenting, some of the work that you've been doing, and we will have a recording of this, and I can send this out to people so that you can have a look at it again. And if you have any questions, please do get in touch with me at vivian.hunt@aut.ac. .nz. I think you've got my email address. And yes, thank you very much, all of you, for calling in. We are going to run a regular series of webinars, and I'll keep you posted unless you let me know that you don't want to be contacted. So thank you very much, everyone, for calling in, and thanks again, Emily and Rhema.
Thank you.